amazing summit anyway. Welcome to the early stage AGI technologies in education, medicine and science, but we will add arts as well, because arts is very important. We are, humans are creative beings, so that's the fundamental that makes us human. My name is Erik Schoppen, I'm the moderator of this panel. I have a background in cognitive and social neuroscience, and I study trust systems in the brain, which is very relevant for AGI systems as well, because they will develop their own trust systems. I'm a lecturer at the Hans University in the Netherlands, so these topics are actually touching me personally, and I'm glad that we have such a diverse and inclusive panel. I think that we have a great conversation the coming 35 minutes. So what I want to do, without further ado, that everyone is introducing themselves within 2 minutes. So, go ahead.
My name is Deborah Duong, and I am CTO of Rejuve.ai, the longevity network that is AI powered. I've been a computational social scientist for over 30 years, applying AI to understanding nature, including biological and social realms.
I'm Joshua Johnson. Hello. Thank you so much for having us. We're looking forward to talking about education and science and different things today. I have somewhat of a balance of a background. I started in China, did my MBA, and was in Sinopharm, which is the largest pharmaceutical supply chain in China. So I have some science background, but now focusing on education and gaming. So we're doing gaming with Sophiaverse, and then Jam Galaxy now we're bringing that to life in Roblox. So we've been focused on Roblox and gaming and gamifying what that looks like, the future of the world and the spatial web. And then also very interested in augmenting human purpose into AI. That's what my thesis way back when, talking about AI ethics, kind of before it was a thing. So that's very interesting to me, and hopefully tomorrow maybe we can talk about it at the Unconference. I was talking to Max more about that. And Pain to Joy is the curriculum that we have. So that process of helping people in that daily journey, in their personal daily growth and lasting joy. So.
Hi, I'm Randall Kuhne. I'm the founder of the Carbon Copies Foundation, and I'm also originally from the Netherlands. I've spent maybe the last 20 or more years trying all kinds of different ways to help advance work on so-called whole brain emulation, so getting towards the technology that allows mind encoding. And in our foundation, we try to do this by, first of all, educating people about it, and secondly, by being a place where we can find how to put people together into projects that deal with the most crucial challenge of this time in that direction. If we want to go in the direction where we as humans can participate in this bigger ecosystem of intelligences that's coming up. And I think that, I don't know if we're going to get to it in this conversation, but there's some really interesting new things that have happened in neuroscience because of the way that artificial intelligence has allowed us to collect and correct data, so that we now have really large-scale data sets that would actually, I think there's even odds that we could, for example, create an upload, an emulation of a fruit fly right now if we knew what we were doing using the data sets that are available from the complete electron microscopy data stack of the fruit fly.
Nice. Hi, I'm Diane Krause, and I'm president and co-founder of the Jam Galaxy music platform. And I'm also a saxophonist in Desdemona's Dream, and it takes me a while to get ready, so I'm halfway there. Because we have like rehearsal and sound check right after this, and then the show. So I hope you all come. I think it's in the Infinity Room tonight. But yeah, a little bit of my background. In 2011, I had like a vision downloaded to me for the global brain, and I have to put this all on paper, but just in listening to everybody's conversations, I believe I have a way to put this all together. So, and actually working with you is going to be probably pretty instrumental in that, I think. I've been studying, I started studying artificial intelligence in 2017, and studied really hard and learned everything I could just so I could understand it. And then like a year later, I met Ben, and I said, oh, I have this concept for a global brain, just read this, paper 3 weeks ago about a concept for a global brain, and I'm like, okay, that's cool. And so yeah, I think we're in such a cool place right now in history, and things are going to be changing so rapidly, but in really good ways. I grew up with a dad who's a rocket scientist, Ken Arison, and he built the Voyager 1 and Voyager 2 spacecraft propulsion subsystems and hydrogen thrusters, and he also worked on the Viking program. So I've always been a daughter of the stars, and I really think about existence as really cool, and I really see the beauty in everyone and how everybody is just an absolute perfect miracle. And that's what we need to remember, and that's what artificial general intelligence is going to help us remember. And I also just heard that there was a panel that talked about ancient intelligence, and which is really cool, because I think of AI as ancient intelligence, and it's just a way it's going to help us tap into all that there already is, it already exists, and artificial superintelligence already exists as well. So we're just going to be tapping into that as we move forward, and at a pretty quick pace. So we can build systems, though, that can meet people where they're at to start to understand this journey. And so yeah, I'm just really excited about this, and excited to be here with all of you. What an incredible event we've put together, and what incredible people to be able to introduce beneficial, benevolent artificial general intelligence to the universe. Yeah.
Awesome. Hi, I'm Kennedy Shaw. I'm CEO and founder of Rejuve Biotech, sister company to Rejuve AI. I'm an evolutionary biologist by training. I was mentored by Michael Rose at UC Irvine, and we are here building a drug discovery platform based on our neurosymbolic AI and crowdsourced human data, and with the goal of solving aging-related disease and human longevity. Rejuve Bio is currently doing a crowdfund. The QR code was up there. It'll be back up there in a bit, so you can link to that if anybody is interested in learning more about that. So, thank you, Eric.
Well, thank you. As you can see, a very diverse panel. That makes the conversation great, hopefully. What I find interesting, this topic has already impact on society, but also on the economy. As a lecturer, my students ask me how does my future looks like in 4 to 6 years. And honestly, I don't know, because it's changing, the technology is changing so fast at the moment, that what they learn at the moment is obsolete in 4 or 5 years. So it's not a fundamental crisis that we have in education, but we have to think about this, and that is why I'm great that we have this summit, that we can have this kind of discussions. So the main topic is how can we facilitate the rollout of early stage AGI technologies in beneficial domains such as education, science and art. So what I want to do, for example, Kennedy, what is your expertise or vision on this topic?
I think in the field of biomedical research, what will be really important is ensuring the diversity of our data sets. One thing that's really exciting to me about the Rejuve project and being a part of it is that we have an opportunity to finally gain a diverse, robust human data set to use our AI to develop real life-saving pharmaceuticals. And in the march towards personalized medicine, that's going to be crucial, because the paradox of personalized medicine is that in order to understand one person really well, you have to understand a lot of people very well. And we've kind of failed in the biomedical research community to do that up until now. Most human data sets that we have from human trials tend to be wealthier white people, and we won't be able to have personalized medicine for everybody unless that changes. And so I think that's really a crucial thing in the early rollout of AGI in biomedical research, is making it accessible for everybody to contribute their data, making sure that there is an adequate and appropriate incentive for people to contribute their data, and letting them be a part of the creation of these products and this research to solve aging and death.
All right, great. Thank you for your answer. And Deborah, can you elaborate something on this topic as well?
Yes. Well, the most important thing for us to do in the near term is to apply AGI to science, because AGI also has potential for disinformation, and human beings themselves don't do science very well. We can only handle reductionistic information, so our job is really to take all those individual pieces of knowledge and put it together in a coherent picture. And I believe AGI is what can help us to be holistic about science and discover all the causal mechanisms behind it, so that we can take all these, scattered small truths and make larger truths out.
All right. So you're from the deterministic school, so to speak. A little bit.
I don't know. I don't see why that is deterministic. I think we have willpower to affect how things go. For example, we may only have a short time to have control because we don't have control over ASI.
No, well, I'm a little bit from the same school. That's the
Yeah.
So if you go then to the other realm, from the holistic view, maybe Randall can say something about this.
From the holistic view?
Yeah.
I don't know if my view is really holistic, but what I've found anyway is that first of all, of course, there's a really strong connection between advances in AI and AGI eventually and neuroscience. There's this virtuous cycle that happens, right? Because as you learn something in neuroscience, you find out more about how cognition is done in the brain, and that helps you come up with parts of this AI or AGI puzzle that we're still trying to figure out. And AI helps you do things in science that you otherwise could never do. So it's not that people are being replaced, for example, or at least in science right now, they're not being replaced by AI, except the things they can do are very different. Right now, you're seeing a huge paradigm change begin to happen in neuroscience, for instance. Like I was at the annual neuroscience meeting in November. There are 30,000 scientists there. 90% of the posters were still all about, say, you make a little perturbation here, you have a hypothesis, you're testing something up here, you're doing a prediction, that's it. You're not really learning about the system and how it works. But there's a small kernel of people. That's all you really need, a small kernel and then some enthusiastic young people who aren't stuck in whatever their lab's already doing. And so you're seeing that there are 200 maybe scientists who've understood that right now we're switching to a realm where AI is giving us access to the kind of data that you need, that you can do large-scale reconstructions of circuitry and really understand what's happening by combining what's going on in one brain region with the other brain region and seeing exactly what's happening. So you're not doing these correlational studies, but instead when you want to predict what's going to happen, you can follow how the activity is really moving down the system. You couldn't do this before. So it's changing the nature of what's possible in neuroscience. It's changing what new people getting into that field can do.
Yeah, all right, great answer. So Joshua, maybe you have something to add to this?
Well, I think to always play the other side, to understand the, here we have the researchers and brilliant minds, but the average person may not understand how we are processing this, right? So I always say, to go back to the theme of this, education, I always say education is marketing, marketing is education. So when we have it for the masses and why we're doing it in gaming, 70 million users a day in Roblox, gamifying that, when you have education and you gamify it, and you gamify it in a way with neuroscience and different ways to understand information and you market it correctly, when you role play becoming something, like in Roblox, sometimes you show 9 to 11 times more retention of that information, right? So I mean, with that number, like even if you have 2x, the compounding amount for education, if it's daily, then by the end of the year, I mean, you do the math. So I think that's where we see in the future, look at education in a different way, a different light. And with the AI applied to that gamification of these spatial webs, these spatial worlds, with the gaming and the internet combined is what I call the spatial web. Now AI helps you take that 2x to 3x to 4x. And that, when you talk about education and then now apply it to science and learning science, that is the future. And I think that is a daily augmentation of understanding yourself, and that's why I go back to Pain to Joy and tomorrow, hopefully, Unconference, that daily personal growth of understanding yourself. It is personalized medicine. You have that based on you. And that in real time, if gamified, you're in real time playing your own world. You're in your own sphere of influence. And that's what's best for you. So I think that that's what it looks like for education and understanding how we make it marketable for the average person. So for me to take and synthesize all of this information, which most of the world doesn't understand, but if we can synthesize it in a way that it is marketable and we can go to market with something that's different, I think that that's actually unique.
Yeah, okay. I understand that the question, but also has some dangers. I mean, you look at OpenAI that just flooded the floor with all kinds of technology. We can see that there is biases going on. If you look at personal medicine, you have a danger of biases. Maybe Kennedy, you can say something.
Well, yeah, I mean, the most publicly facing example of this that we've seen recently is that pulse oximeters don't work on people with dark skin. That's an example of bias in biomedical research that we have fallen victim to up until now. And that's something that we have to change. I mean, if personalized medicine is going to succeed, if we're going to create effective therapies that work on the personal level and for everybody, we need to alleviate that. I mean, I believe that starts with how we go about sourcing our data from diverse populations to help remove that bias, and then also making sure that our AI models control for that bias as well. So.
Yeah, so you're touching inclusivity.
Right.
Maybe you can tell something about Jam Galaxy, and maybe this is about something about inclusivity.
Yeah, sure. I mean, the great thing about Jam Galaxy is it's starting with music, and everybody loves music, and we are all made of music, together we're music, the whole universe is music. And it's a cool way to begin because so many people are digging into this passion of theirs that they really enjoy, and through that process, we can start to educate people on these topics that we all know very well. And also through gamification as well. I really think that's a cool way to just start to teach and help people understand what's happening and what can happen. And then from there we just we just end up on this journey together. I think of us all as like stars, where each of us is a star, and our relationship to each other is like stars relating to stars and stuff like that. So. It starts us on this journey of discovery of our own divine nature and where we go with all this. We have AGI and ancient intelligence here to teach us about how to do this, and it'll be accelerated. But at the same time, AI can also help each individual. It will meet them where they're at to help them on their path. So it's not just like, here's what it is, that kind of thing. So it's just like asks a bunch of questions, has a really great conversation about discovering your joy, discovering what makes you happy, discovering why you are so special. And so starting with music is just a really great way to do that. And I'm really excited about the future. I think we have a really beautiful future in store for us.
Right, yeah, thank you. Great answer anyway. It's time to bring a new topic into the discourse, and I want to talk about ethics. These domains have huge impact on the new generation, because the students of today are the leaders of tomorrow. So how can we navigate the ethical considerations and maximize the benefits of AGI in these industries? Maybe I can start with you.
Okay. AGI is a neutral technology. It can be ethical or unethical depending on who uses it and what they use it for. In a sense, it's unethical in that it's a power, and it's a power that can be given to everybody now, and is dangerous in the sense of everybody having a nuclear bomb in their backyard being dangerous. Somebody's going to press a button, right? Mm-hmm. So what we have to do to be ethical about it is address the possible things that can go wrong as soon as possible. And one of the main things that can go wrong is disinformation, election tampering, job loss, and just changing our perceptions of reality. And so one of the things we can do to combat that is use the AGI itself to simulate what happens to our social structures when they have a certain infrastructure behind them, and who's working with them, and how is it that we can cause a fundamental change in that. Rejuve.ai is working to combine blockchain to cause a change in that infrastructure so that instead of the rich getting richer and the poor getting poorer, that labor cannot be sold to other people so easily, that people can always expect their IP and their data from their bodies to be protected, and that the blockchain ensures that with every sale of product that someone contributes to, that they get their fair compensation in proportion.
All right, thank you. So Joshua, maybe you have something to add on that?
I think I was talking to Ben about this yesterday. He's big into education, and so I think it starts with education. We were talking about basically a consumer reports for education and tools around AI. So education, and from a non-biased point of view, and this with sNet being the largest decentralized ecosystem, I think this is a great opportunity to kind of lead the charge. And the 100 AI companies out there, 100 universities, 100 multinationals that support this growing, knowing this is the future of humanity, what that looks like. So like almost like Reddit uploading, hey, this is a very decentralized way about a 6-year-old and I'm a young single mother. How do I teach my kid AI for video, just to enhance, he wants to create a YouTube channel or a TikTok, right? So in real time, you're able to understand that collective force of knowledge and that enforcement, and from a non-biased point of view. And I think it's very important for AI, I think. So education being that focus, and letting the cream rise to the top, and that being the focus.
All right, thank you. Diane, I see you nodding, so maybe you have something to add on this?
Yeah, I was just thinking about just in relation to educating and connecting with people. I lost my train of thought. It was what I was thinking about before this, but oh yeah. So just as we get into the system and as we get into educating, I actually when my daughters were really young, I designed an early childhood development program. I'm going to launch it at some point, but it kind of just starts the individual down the path. And so I think it's really important that from the start, we put together a system where people own all of their data. They own their music, they own their art, they own their attention also. So you own what you pay attention to, you own a record of your attention, you own the present attention, you own any prediction of attention based on what you pay attention to. And so I think that that's also a huge thing that we can start to teach each other, because then they can become more aware of what is actually happening out there in society. And then if we're connected to owning that and deciding what we want to be putting out there and that kind of thing, then I think that can kind of help curb that path.
All right, thank you. Yeah, because we want to keep the systems inclusive for everyone. So Randall, what's your opinion on that one?
Yeah, so I think that an enormously important thing in all types of ethics is that you can't assume that any one group of people, individuals, institutions can understand a problem, can understand something well enough to even think of all of the ethical issues that might be involved or how to tackle those matters. So that's where we kind of come back to a topic from yesterday, which was openness, decentralization, open source, all of those aspects that put more eyes onto something, because as we've seen over history, as our own sort of human civilization, moral values and ethics have grown, this has come largely by being more in contact with others outside of our limited circle. So getting other people included into the conversation, those you might not think of. So we had, for example, you just mentioned this issue of dark skin, right? So it's really a matter of inclusiveness and openness. That's the way to get closer to a better understanding, especially if you're not just looking at, say, ethics in terms of the development of AGI, but we're also talking about ethics of the people who are being impacted by it, by society at large, or patients in the case of medical technology, for example. So there are just so many different groups, and you really have to open it up.
Yeah, right, thank you. But that brings me on one of the classic ethical dilemmas, and also one of the most complex one, and it is the access to education, access to medicines, access to arts, and access to knowledge. So, Kennedy, can you say something about that? Because I know that you have an opinion on that.
Right. So yes, access is very, very important, and as I keep hammering this thought about what's going to make personalized medicine work, and that's including everybody, and that starts with making sure that everybody has access. Like everybody, needs to have an access point to contribute their data, to own their data, which starts with internet access for everybody. Everybody having some kind of a computer or a device that they can use to own their data, own their money, own own their labor, and be able to have agency and authority over what is done with that data as well. That is paramount, and that is really where the revolution, particularly in AGI for biomedical research, is going to come, and that's how we're going to come up with beneficial treatments for various diseases faster, with a reduced failure rate, get across that translational valley of death, going from the lab to the clinic. And it is absolutely paramount that this is for everybody, and that we stop siloing data and siloing information with big multinational corporations, with big pharma companies. Decentralization is key, and inclusivity and access is paramount.
Yes, thank you. So maybe Deborah, you have something add as well?
Yeah, I completely agree with Kathy, but I would also like to add that it's not just decentralized data, but decentralized AI for decentralized science, that we must include everybody's contribution. And if we unlock the talents of people who have been suppressed because of their demography or their educational background, and we include them in there, then we have all the more knowledge with which to put together a holistic picture.
Yeah, okay, that makes sense. How do we see, how could AGI contribute to increase this access? Looking at you. Randall, sorry. Yeah.
How AGI can contribute to access?
In the domains that we talk about.
Yeah, so in order to improve ethics, for example, in the development of AGI itself, I think in part it can do so by making it possible for people to participate that otherwise wouldn't, because they would have to spend an enormous amount of time studying how to have the skills to do very mundane things just to be able to be involved at all in the conversation. But instead, through the use of AGI as a way to pull together knowledge, get better access to that knowledge, apply it, you make this available to many more people. A great example actually has been, for example, the Neuromatch Academy. So one of the most wonderful neuroscientists that I've worked with is Conrad Cording at the University of Pennsylvania. And he has really emphasized not just what neuroscientists are doing wrong right now and how we should be working instead, but he's also been instrumental in creating this Neuromatch Academy, which is free to all. You can just participate online. You can spend a few weeks working there and learning how to use machine learning and AI in neuroscience in this case, right? So you could do this for other sciences as well. So this is kind of democratizing the access to those technologies and bringing people in who otherwise wouldn't have known about it, wouldn't have known how to apply it to their problems, wouldn't have even thought about it. But because they're becoming involved, they're also going to start thinking about issues related to AI, because they're now really dealing with it, they're touching it every day. So that was a fantastic experience helping to lecture there.
Yeah, okay, thank you. Joshua, what is your vision on this one?
No, it's interesting. I think education and healthcare are the two slowest moving in terms of legislation. Legislation is going to be a part of that. Of course, it's funny because that's why I stayed in China as the healthcare side, Sinopharm. We were the only public-private party to connect to the Chinese FDA for the health data. So knowing that end-to-end was a whole system that I had thought of, but basically knew that legislation would just took way too long. But being able to control more of it in the gaming side, that's more realistic for me anyway. So being able to see that come to life with just the internet connection, that's why with like Roblox, it's low poly. It basically doesn't even need a smartphone. And your access to those 70 million kids a day is actually very tangible in terms of being able to communicate and have that gamification. And with that form of gamification in the future, as 5-10 years out, with the spatial web, you have Apple Vision Pro and various things in different contexts, physical, non-physical, online, offline. I think they're going to take on a new realm of what is reality, right? And that new reality will be able to help education, help science in a different way that we've yet to even begun to see. We honestly can't even fathom it. So I think that with that, I think that's the next frontier in education, is for what I can see tangibly being able to do now because of legislation slowing things up. That's why I actually exited healthcare. But I can control more of it in this side. So that is interesting to see kind of the paradigm of both sides, and that AI education, I think in terms of marketing is education, education is marketing. If we can reach the masses in a way that we articulate that balance, so anything good taken to the extreme can be bad, as long as we understand that balance, I think that'll be the key.
Okay, and based on your answer, then I have a question, also for the others, but should we accelerate or slowing down the development of AGI?
Well, no, I think that for me, it's like any press is good press. It's like, so if we basically continue on this conversation, that we're here today because we're having this conversation and we're having and communicating around this. So for me, having this where the people may not even understand what we're up against. And there may be something that we have to slow down, right? But since we're having that conversation, if we don't actually bring it to the table and communicate, we have to understand that balance. So what is it? What is that extreme? And we have to understand the data one way or another. And so that extremeness, we have to see this is the extreme, this is the extreme, and then the balance of the two. And that's what I think that we're here today. I know this particular conversation, this particular audience, with this particular demographic may think one way, and then we have the other side. But we have to take a balance of all of it. We can't just be biased because we have this set of people in this set structure because collectively we think this way, but other people in the world may think differently. So those also have unique minds. So how do we balance all of it?
But that brings challenges to the table because science is very slow. The whole system is based on peer review. It takes some years to publish stuff. Education sometimes is very conservative, and now the acceleration is going so fast that these domains can't keep up. So actually we create not even a gap, but even a void. So that's a real challenge. So maybe Kennedy, you can say something about this.
Oh yeah, and I think the real basis for solving those issues comes with good regulation, a good regulatory framework. I mean, in our case with biomedical research, like the FDA is so slow, and getting trials approved, medicine approved, all of that is just a nightmare of red tape. I mean, from the aging-related disease perspective, you can't even file for a trial or a pilot for an aging-related disease. You have to have a specific disease indication. Well, 90% of chronic diseases is caused by the aging process. So if you are able to conduct a trial that looks more like aspects of aging, you could solve multiple diseases at once. But no, that would be too efficient, I guess. So we're still stuck in this like traditional way of going after one disease indication and then hoping it has anti-aging or regenerative side effects, which is just like it's so slow. So I think that the answer to this issue starts with a regulatory framework that is appropriate for the technological environment that we're facing and how it can maximally benefit all these fields.
Well, thank you for your answer. I think this is a great final word because I have to message that we have to stop and you go to lunch. I hope you find this 35 minutes insightful and maybe it will bring further discussions on later on. Thank you very much.
Okay.